For veteran opera singer Robert Mitchell, 2020 has been a difficult year.
To be told you've got cancer is pretty devastating.
When a test earlier this year returned troubling results, Robert's doctor asked him to follow up when he returned from an overseas trip in March. And then COVID struck.
When I got back from New York, I had to go into quarantine for 2 weeks. So it was virtually 2 months, or just over 2 months, between the tests instead of 1 month. And it turned out I had a quite high grade level of prostate cancer.
After the delayed diagnosis, Robert was rushed in for surgery to remove the cancer.
It was fairly urgent because, as I say, it was deemed a high grade cancer. It was like a body blow, absolutely a body blow. So it's really just changed my life.
National figures released exclusively to 7:30 by the government's peak cancer body reveal substantial drops in the diagnoses and treatments for 3 of the most common cancers during the lockdown. While such a decrease had been widely predicted, this is the first time it's been confirmed by official data. Non-surgical treatments for skin cancers dropped by 1/3 between March and April, but then started to recover as the lockdown restrictions eased. Mammograms, which detect breast cancer, fell by 37%. And there was a similar trend for colon cancer. Colonoscopies halved from March to April. Numbers have started to recover, but they're still lower than last year.
There is the patient feeling that they don't want to go out and they don't want to risk their health by going to see a doctor. The hospitals were concerned about whether they'd be able to cope with the workload, and so some procedures were reduced or stopped for a while. I think from these data we could probably extrapolate to almost any other cancer and say that it's highly likely that there were delays in diagnoses of all the cancers.
Cancer Australia CEO Professor Dorothy Keefe says those delays will have serious consequences.
We would expect that the cancers that haven't been diagnosed in the early part of this year will be diagnosed either later this year or earlier next year, and they will probably be slightly more severe cancers.
I'm 2/3 of the way through chemo and radiotherapy, so I'm feeling a bit ordinary at the moment. I'm in isolation because I'm immunosuppressed.
Jeff Voller considers himself lucky. His aggressive stage 4 jaw cancer was diagnosed just in time, but it took months to get there.
I went to see my dentist in about the middle of January, and when I saw him, we decided that it was just an irritation at the back of my jaw. In the meantime, what happened was that COVID came along and I couldn't get back in to see my dentist.
Eventually, in June, he got his wisdom teeth removed by a specialist.
He gave me a call and said, "Look, Jeff, when I was taking out your wisdom tooth, I took a biopsy and it looks like you've got a cancer of the jaw."
Hey Jeff, how you going? Nice to see you.
They've actually taken out the left-hand side of my lower jaw because that was cancerous, and they've replaced it with my fibula from my leg.
Jeff's surgeon has been noticing a trend among his cancer patients at the Chris O'Brien Lifehouse.
I've seen that there's less referrals coming from GPs.
Just to sit forward.
I think you probably will see some patients with more advanced cancers presenting that will require more complex treatment and whose potential outcome would have been jeopardised by a delay and by lack of access. And I think it's going to place a significant strain on our healthcare system.
Professor Dorothy Keefe believes it's time to shift the conversation from a focus on the short-term health imperatives of the crisis to the longer-term impacts.
The lockdowns are absolutely vital for stopping the spread of the pandemic, but as the months go by and as the pandemic enters different phases, we have to think to ourselves, well, what about the other health impacts of the lockdowns and of staying at home?
Jeff Voller's message for others is clear.
Don't let COVID get in the way of you seeing a doctor, because the time that you spend waiting to get something done might be the difference between, in sometimes, life and death.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.